And as CEO of the National Rural Health Association, I want to welcome you all here and very, very briefly, hopefully set the tone and a shared understanding of what rural America is as we go ahead and hear the rest of the sessions throughout the day. First and foremost, just so we have a shared understanding, rural is not a small version of urban. It is a unique healthcare delivery environment. And while rural America represents 80% of the US landmass, it represents 20% of the US population. And this is a very distinct population. That unfortunately, we've seen this play out during the current COVID pandemic that we all are facing. If you live in rural America today, you are more than twice as likely to die from COVID than if you live in an urban area. And the reasons for that are systemic to rural populations. Rural America is older, sicker, and poorer. Currently in rural, there's an 80% higher infection rate among the population for COVID-19. And at that same time, you have a 10% lower vaccination rate. Now, just central to everything you're going to be hearing for the remainder of this day is this healthcare system in rural America was established and set up for primary care and general surgery. And it does that extraordinarily well. When you look at quality measures and compare rural to urban, you see that rural compares as equal to, or in many cases better than urban counterparts when we're talking about primary care and general surgery. So the important thing on this is that the challenges that we face in rural, and the challenges you're going to be hearing today, drive innovation within a rural context. And rural America really serves as an innovation hub as a result of that. Whether it's dental health aids, teledentistry, the integration of primary care into dentistry itself, these innovative new approaches emerge among rural communities. And you're going to hear that today. So let me close with just these words, rural health. After this, Google, Yahoo, or Bing, the words rural health. Our website is always one of the first three that comes up. And on that website, you can see more about our rural oral health initiative, which identifies best practices towards expansion of oral health services within a rural context. So it's my pleasure to participate in this important conference today. Welcome you all, and what a great day to talk about rural health. So with that, let me turn it over to Tom Morris.
Great, thanks, Alan. And just really want to say it looks like a great agenda today, and I see a lot of familiar names. Marsha Brand and Paul Moore and Sarah O'Donnell from our staff will be talking later on opioids. And yeah, I want to echo what Alan just said. You know, I think that there's a lot of stereotypes out there about rural, and I think it's incumbent upon all of us to sort of offer a fact-based vision of what rural is and what it deserves. And Alan, in particular, I think does a great job on that. Just yesterday, I was on a NIH meeting in which this actually was said. It's finding it hard to believe. Most of the clinicians in rural areas are only there to get their loans paid off, and most rural communities can't support a full-service hospital. And those are the sort of myths that you hear out there that are definitely not true, and are sort of paternalistic when you think about it in terms of you know, sort of an urban view sometimes of these things. So you know, I've been doing this a while, and Alan in particular, and I try to emulate that, is you know, having a realistic discussion about the challenges in rural communities, but also, you know, what they can do. We often get sucked into sort of talking about gaps and disparities, and those are all there: higher rates of chronic disease, you know, workforce challenges, all those things. We know that's particularly for oral health. And yet there's a lot of things that really do work quite well in rural, and it's nice, I think, to sometimes point to those. We just note very quickly that the Federal Office of Rural Health Policy is located in the Health Resources and Services Administration. We have a really interesting job in the sense that while we're in one of the HHS agencies, we have a department-wide charge to advise the Secretary on rural issues. And so it's actually a nice situation because we fund a number of programs and research that then informs our policy work, and it allows us to really you know, respond to that. The a couple of issues that we're tracking on. Obviously, the pandemic is front and center for all of us. We've been fortunate to have some resources to put out there to support rural communities, and hopefully that's having an impact. The other thing I guess I would note is that rural is a bipartisan issue, one of the few that's left. And because of that, we've had good support both from the Congress and the past few administrations about making this a priority. The other thing I'd say is just that, there's a number of resources in our office that maybe have helped to you all. In particular, we have funding for community-based efforts. We are also supporting the creation of new rural residencies in rural communities. And I do want to touch on that very quickly, because while we can fund rural residencies, if you think more broadly about HRSA, through the Teaching Health Center program, through some of the other Title VII and Title VIII authorities that exist within the Public Health Service Act, we can fund a range of training, and all of it's focused on rural and underserved areas. And so just based on the agenda you all have today, you're going to cover a lot of territory. I hope it all turns out great to you all. I want to thank you for the opportunity to join you today.